How do type 1 and type 2 diabetes affect flu risk? Imagine catching the flu and feeling worse than usual. For people with diabetes, that extra challenge is often linked to how their condition affects their immune system and blood sugar control. Both type 1 and type 2 diabetes can make fighting off the flu more difficult because they weaken the body's defenses. This means people with diabetes are more likely to develop serious complications like bronchitis, ear infections, sinus infections, pneumonia, or even hospitalization. When someone with diabetes gets the flu, their blood sugar levels can become very hard to manage. The infection triggers stress hormones like adrenaline and cortisol, which can block insulin's ability to lower blood sugar. This can cause blood glucose to spike dangerously high, leading to conditions like diabetic ketoacidosis, where acids called ketones build up in the blood, or hyperosmolar hyperglycemic syndrome, which involves extreme dehydration and very high blood sugar levels. Both are serious emergencies that requiring immediate medical attention. Blood sugar fluctuations, known as glycemic variability, are common in diabetes and can make flu symptoms worse. Scientific studies using cell and animal models show that these fluctuations can increase lung tissue damage and inflammation during influenza infections. This results in more severe illness, greater weight loss, and longer recovery times. Influenza can also destabilize blood sugar control in people with diabetes, worsening existing health issues like kidney disease, nerve damage, and heart problems. Data shows that people with diabetes are more likely to be hospitalized from the flu, with about 30% of adult flu-related hospitalizations involving individuals with diabetes. The flu can even trigger heart attacks and other acute cardiovascular events in this group. There is some evidence suggesting that flu infections might increase the risk of developing type 1 diabetes in the months after infection, possibly due to autoimmune processes. This highlights how complex the relationship between flu and diabetes can be. In summary, having either type of diabetes raises the risk of catching the flu and experiencing more severe health problems because of impaired immune responses, difficulty controlling blood sugar, and increased chances of complications. To reduce these risks, it is highly recommended that people with diabetes get an annual flu shot and closely monitor their blood sugar levels during illness. Always consult healthcare professionals for personalized advice and treatment plans to stay safe during flu season.